Hi, my name is Yusra. I'm a second-year dental student at ATSU-ASDOH program. My family is originally from Pakistan, but Texas is where I was raised, and that's where I'm coming from. I went to University of Houston for my undergrad. ASDOH, I think, is an amazing program. It has very good clinicals. By that, ASDOH is one of the only programs in the country, few of the only, that offers external rotations. As a dental student, I wanted a program that has strong clinicals because I didn't want to go out after school and get additional schooling done. ASDOH is very strongly rooted in public health, and I really liked it. We have a lot of outreach programs. As a students, we're required to do at least one outreach program every semester, and I think that's really good. ASDOH has so many opportunities to just give to the public in community dentistry, in public dentistry. ASDOH also has a master's, and unlike many schools that add a year when they do their master's, ASDOH has a dual degree where you're not spending another year. So within the 4 years, you're also getting a master's of public health and you're getting your dental degree. ASDOH has mentorship plans, and it's not just one program. Like, you have a mentorship that, like, you have someone in the D3 class, you'll have someone in the D4 class, you have every upperclassman, you have a mentor from each class, and then you have a mentor that helps you with didactics and academics, and then you have a clinic mentor that can help you in the clinic. And ASDOH has their clinic divided into 4 groups. We call them CCUs, and that essentially reduces the number of students, and then you have 2 directors. So one director would have only like 8 to 10 students, which gives you their undivided attention, and I think that's really nice. And everyone is so helpful because you have those mentors, you share patients, you get to really know each other, and everyone's really helpful. And I think that's the part where he's like the stress, or it really helps because you're going into clinic, you don't know anything, and now you have all these people who are willing to help. Like, I have asked my mentors questions while they're with the patient, and they'll still help me if I'm freaking out. So I think that's remarkable. And then you also have, like, academic-wise, you have a mentor, so you could be like, hey, how was that class, or how is that class? So I think that's really helpful. And then it's a pass and fail system, so you're not constantly competing to be the top rank of the class. You're not, so everyone in general, like, will make study guides and we'll share it with all of us. Or if someone has like some things, they're like, oh, the professor said to focus on this thing, we'll share it with everyone else. So I think that's really nice, and it takes away the stress. My group went to an elementary school, and then we gave like dental education. So ASDOH really puts you out there. In 3rd year, we also have a sealants program where we go across the nation and then we put sealants to students. ASDOH also works with the prison. Like, we have a lot of juvenile patients also, which I think is, all of this is like so much experience that you're getting, which you wouldn't get in other schools. Like, you're out in public, you're working with special needs, you're working with pediatric patients, you're going outside of the state. Like, it's covering dentistry on the whole scope, and it's beautiful. ASDOH has prepared me like very nice, and I think as we continue, like, we're doing a lot more than other students as second years. Like, I know my friends who are in other schools and they have just started seeing patients when we're already doing like RPDs and we're treatment planning implants. So I think overall ASDOH will really prepare me where I wouldn't go for advanced education. I think I'm gonna be a general dentist, and I'm probably eventually gonna own a practice. I want to be a practice owner eventually, but I'll probably work a little, get my experience, and then own a practice.